for every action, there's a reaction. And so if you talk good about people, they're generally going to talk good back about you. If you talk nasty about people, guess what? You're going to get the same thing back. Hello, doctors. Dr. Todd Osborne. And I wanted to cover a principle for you today that is not only going to be very valuable to you in your practice with interaction with your patients, but it's also a principle that just helps us in everyday life, in all our interactions with whatever we're doing, whether it's with our family, with our friends, with the public. This will make a difference in your life. And it is looking for the good in people, seeing the good in people. And we live in a society today that actually looks for the negative in everything and everybody. And it's very easy to get caught up in that particular way of doing things. And it is not a good way to interact. It's not good for others around you, and it's certainly not good for you yourself. And when we talk about looking for the good in others, it's really a mindset and how you are thinking and what your perception is. And as I've always tried to do myself and teach to my kids as they grew up, is there's good in everybody. There's something good that you can find if you're looking for it. There's also something bad if you're looking for it. And so what I would teach them is, hey, whatever you're looking for, that's what you're going to find. So I think we would all be better off if we were able to look for the good in situations and look for the good in people. And as Dr. Owen used to always say, thanking God is thinking good, and thinking good is thanking God. And so if we are thinking good, if we are looking for the good, we are going to have much improved relationships in our life, and it will certainly help your practice. When patients come in, they're obviously in different states of health, different states of mindset when they come into your office. And so sometimes they can be difficult when they first come into your office, but we want to treat them good. We want to say good things about them, because eventually, and you folks that have been in practice for a while have seen this, someone comes in, they're very grumpy, and I tell my team members, look, it's because they are not healthy. Their body is not working the way it should. Their physiology is not functioning as it should. But just wait, give them 30 days and look what starts to happen with chiropractic care, and as their health starts to come back. And that person that came in that was grumpy, that the team didn't really care for, now is one of their favorite patients, because we looked for the good. We tried to see what was happening with that patient and look for the good and speak out the good toward them. And before long, guess what? They're feeling better, and now they're seeing the good in us, and they're out talking and telling other people about us because we made the investment of thinking good about them and talking good about them. And it really all comes down to action and reaction. Dr. Owen always told the story to get this point across to us, but that was the fact that for every action, there's a reaction. And so if you talk good about people, they're generally going to talk good back about you. If you talk nasty about people, guess what? You're going to get the same thing back. And these actions and reactions are predictable. And that's why we have a system set up with our procedures and protocols in our clinic, because we know for each action, there's a predictable reaction from that patient. And Dr. Owen always told this story on this principle, and he loved banana pudding. And he said he had been working with this doctor, and so he wanted to get this point across to this doctor that for every action there was a predictable reaction. And so they had spent the day together, and then they got together with Miss Jackie. She was making dinner for them and the other doctor's wife, and they got together for dinner, and they had dinner, and for dessert, Miss Jackie brought out banana pudding. And so Dr. Owen showing this other doctor that there's a reaction for every action. Miss Jackie asked, "How was the banana pudding?" And Dr. Owen said, "Well, it's a little sweet. I wish you'd make it the way Mama made it." Well, all of you out there know exactly what that reaction was. And Dr. Owen said he really paid a steep price for teaching that principle to that doctor, because it was about 20 years before Miss Jackie ever made him banana pudding again. And so he tells that story to get the point across that we all know what that predictable reaction was going to be from Miss Jackie, right? And so the same thing goes on whether we're interacting with our spouse, with our friends, with the public, with our patients, that there are predictable reactions. So we want to make sure that we're putting out the good. We're looking for the good. We're seeing the good in people and essentially expanding on that or expounding on that of, hey, there may be just this little bit of good there, but let's concentrate on that. Let's focus on the positive. Let's talk about that. Let's tell them that, so that we can get that predictable reaction that will come back, that's going to be the positive, that it's going to be something good. So doctors, please put this in play. Go in with your team members. Look for the good that your team members are doing and reward them for that, or just tell them that they're doing a great job. Look for the great things that are happening with your patients, whether it's some of their condition is improving or whatever it is. Talk about that to them. Thank them for saying good things about you out in the public. And maybe they haven't done that yet, but by saying that, maybe it's a trigger for them to go out and say good things about you in the public. So thinking good is thanking God, and thanking God is thinking good. And if you will look for the good and talk about the good and tell others about the good that you see, it will be very beneficial to you, your practice, and your life overall. So hopefully this is a good tip to help you guys today. And if you want more, make sure you subscribe to the channel here. Make sure you like it, subscribe. And then if you want more information on not only this, but many other procedures, protocols for practice, and just how to be successful, please go to amcfamily.com. Appreciate you guys. Have a great day, and God bless.